I'm really excited to have Laura with us because this is a new program that was new to me, and I really wanted my advocates to learn more about it and just share what she's working on. So, Laura, if you want to jump on, and you should be able to share your screen and introduce yourself and what you're working on.
Okay, thank you so much.
Laura, we can't hear you. I don't know if you're talking. It looks like you're unmuted, but we're not hearing anything.
Oh my God, you guys can't hear me at all?
Oh, now I can hear you. Yeah,
okay.
Now.
Yeah, I don't know what happened, but I'm glad you guys could hear me. Let me share my screen. So just bear with me to make sure that I set this correctly. Okay, I think you guys can see my screen now, right?
Yes.
Awesome. Okay, thank you. So thank you so much for the opportunity to present. I'm super excited to talk to you guys about ECM services, which is basically enhanced care management services. So my name is Laura Falcon. I'm the clinical consultant for Community Connect, and this is a program that is being offered through Adventist Health. And so I want to just share as far as our program and what it is. And so that way, hopefully we could partner up and really provide these services to all of the individuals that could benefit from our services. So ECM was established in January 1st, 2022, so effective this year. This was developed by the Department of Healthcare Services as a new statewide Medi-Cal benefit available to select populations of focus that will provide a wraparound approach to care and address the clinical and non-clinical circumstances of high need enrollees through an intensive collaboration and coordination of health and health-related services. So the goal of ECM is to really improve the health outcomes by providing a comprehensive care. So the focus of ECM is to improve care coordination, integrate services, facilitate community resources, also address social determinants of health, and improve health outcomes, as well as decrease inappropriate use and duplication of services. And so there is 7 core services that our program offers. The first one is outreach and engagement, which is basically reaching out to our members wherever they are, whether out in the community or out into the clinics or the hospitals, wherever they prefer, wherever they feel comfortable. We use different means of communication, that it could be over the phone or in person, or also through emails and mailing letters. And we provide a comprehensive assessment and develop a care plan to really support the needs and preferences of our members. We also provide enhanced care coordination, and what that means is that we work with different providers to make sure that we're working towards the priorities and the immediate needs of our members. And there's a lot of health promotion that we also provide with ECM, and what that means is that we help our members to really understand their health needs, to really be able to advocate for themselves. So we do that, and we coach them, and we use motivational interview to really support them and make sure that they live the best lives. We also provide comprehensive transitional care. So what that means is that some of our members could be in the hospital or could be in a skilled nursing facility, and they might eventually want to go back to the regular house. We support them to make sure that we are working together towards making sure that our members are transitioning into a lower level of care, by making sure that they have the right needed support to facilitate that process. And we also work with their members and their family support when it's appropriate, to make sure that everyone as a team is coming together to support the member. We also do coordination and referral to community and social support services. So we ensure that we are making those referrals and also following up with the different providers to make sure that they are picking up referrals and providing that service. So we follow from the beginning till the end of those referrals. And so currently we are offering ECM services to 16 different counties, and this is possible through Adventist Health. So Adventist Health is contracting with multiple health plans to provide ECM services. And MCARA is basically how this service is being provided. I work for MCARA, which is a value-based national medical group that is known for providing in-home primary care to vulnerable and underserved populations. So that is how Community Connect is able to provide ECM services through a partnership with Adventist Health. And what is Community Connect? Community Connect, as I mentioned, is a program that is being offered through Adventist Health. So this is a program owned by Adventist Health, and basically Community Connect is composed of care managers that are deployed into the community. So anywhere in the community in Kern County, we are serving individuals wherever they are to identify and address social and behavioral barriers to access, to make sure that they have access of their health care services that they need. We have the community care workers that are being provided, that are taking the lead with providing those services, and they're being supported by a registered nurse and a social worker. The social worker that is focused in the non-clinical aspects, while the registered nurse is focused on the clinical aspects. And so the teams are able to assess patients for social, emotional, and behavioral risk factors to make sure that they gain access to local primary care as well as community resources. Some of those community resources could be food, housing, transportation, things in that nature. And so the care teams are able to develop individualized care plans to make sure that the members are getting their needs met and that their health goals are being addressed, to make sure that we support and assist our members to make sure that they're accessing, they know how to access their needs, whether it's medical needs or non-clinical needs. And so there's three components of our program. The first one is the engagement and assessment. So as I mentioned, our community health workers, they go anywhere the members are, as long as it's a safe place and as long as it's comfortable for the member. The community health workers are for the community, so they know the population that they're serving, and they have also connections within the community and the entities that are in the community. They assess for social determinants of health and behavioral needs. They create plans to improve the social conditions and remove barriers to clinical care and treatment. And the care coordination really focuses on working together with the PCP, the specialist, the dental provider, the social service providers, also assisting with supportive transition plans. We attend appointments with their members to help them to make sure that they're asking the right questions. We help them to just be able to advocate for themselves and really navigate the different systems that they are having to deal with. A lot of them are lost, and so a lot of them don't have the tools. And so we also work closely with the Adventist Health management team to make sure that the care plans align with the services that they're providing as well as that we're providing. And then the referral support, like I mentioned, we basically work with community-based organizations to make sure that our members have the needed housing, transportation, and financial as well as food needs that they might be struggling with. And we also refer to Adventist or their PCP for any immediate clinical needs. And we, like I mentioned earlier, we follow up to make sure that those referrals are being looked at, that they're being that they're executed to make sure that the members receive that support that they need. And we work with the members' support system when it's beneficial to support the members. And so our current ECM team is composed of lead care managers. So we have Akila, Ginger, and Mark that is currently serving the community. And we have a registered nurse, which is April, and myself, who is the social worker that right now is currently providing oversight to our Kern County. Eventually, the team is going to grow more as we develop this program, as it's a fairly new program, and so we're still working on it. But as of right now, this is what our team looks like. And so the eligibility for ECM services consists of three populations. The first one is adults that are high utilizers of the ER for non-emergency care. And I'll go over more of the specifics when we go into the referrals, just to show you as far as what that criteria looks like. We also are working with people with severe mental illness or substance use disorders, as well as people that are experiencing homelessness. And this is what I mean as far as really working side by side with them to make sure that they're able to advocate for themselves, that they're able to ask the right questions, that they're able to understand how to make sure that they maximize their benefits through their insurance. And so the referral process is pretty simple. Either CBOs could refer the members, or medical providers could refer members. The member could also call and refer themselves based on the criteria that we are serving. And so they could either call or email us. They could also fax over information regarding the member. And we from there either submit the referral to the medical insurance provider, or if not, if we are just being told that there's a member that could benefit from the services, then we complete the referral. So we could make it as easy as possible for anyone, whether it's a provider or the member themselves that might need some support and help submitting the referral, then we do that. And then we submit it to the insurance provider for authorization. And the authorization takes between 3 to 5 days. They're actually getting faster now that ECM services are they're more familiar with the process. And then from there, we assigned a community health worker that will meet with the individual either at home or in the facility that they're located, or any community location that they feel safe. And so there is 3 ways to submit referrals to us, and that is through just calling or emailing us the referral the information for the member, so we could touch bases. And I could go over the basic information that we would need, as well as it could also be faxed. And this is what our brochure looks like. So I could send out the pamphlet and some information to you guys, so that way you guys also have it in more detail. And this is what a referral looks like. It's really a 2-page referral. It's very simple. Basically, we just ask for their basic information as far as their name, the type of insurance that they have. Right now in Kern County, we're only able to serve individuals with HealthNet, and we're in the process of also getting approval to be able to serve Kern Family. So that's in the works, but as of right now, it's only HealthNet. And we need the member's ID information, as well as their primary address or mailing address that they're using, and a way to contact them. And then we also have to justify it, and this is something that we'll do, that we just have to basically indicate how they're meeting the criteria. And the population focus right now is individuals with mental illness, as well as substance abuse, or individuals that are high utilizers, or individuals that are homeless. So eventually our populations are going to grow to 7 populations, and that is going to be effective next year. And this is going to be one of them, but that's hopefully next year. So up to 7 populations effective next year. And so individuals experiencing homelessness have to have a complex physical, behavioral, or developmental condition to be able to meet our program. And here it explains as far as who is considered homeless based on the Department of Healthcare Services definition. So it's really nicely defined there for you guys. And then the second population that we are able to serve is high utilizers of the ER for non-emergency needs. And the way this is defined is in the period of 6 months, this would be 5 or more emergency hospital visits, or 3 or more unplanned hospital admissions, or multiple short-term skilled nursing facility stays. And that's how that is defined. And that's also there for you guys to be able to reference. And the third and last population that we're focusing is for individuals with serious mental illness or substance abuse disorder with a complex social factor influencing their health. And here you'll see the different boxes that those could be selected. And then for the first population of homelessness, any of these categories, it doesn't have to be all 3, it could just be one category that you select. And again, just defining as far as why this individual would qualify for ECM services. Are there any questions?
I know I have some questions, but I don't know if anyone else wants to throw any out first. I have a couple of questions. I'm thinking about, how this would play out for us. And we also have Jennifer Williamson on today, who is the clinical manager at the Behavioral Health Center up in our local community. And so one of the things that I'm wondering about is if we are obviously working with someone who fits into one of those categories, and we make a referral to you, we're obviously like community-based resources that could continue to provide support. But what does that look like in terms of communication between your program and ours, confidentiality, HIPAA, all of that? How closely do you work with community-based organizations that are right in that person's local community?
So it really depends on the member. Our services are very individualized. So there might be some members that might not necessarily need us to work directly with the different CBOs, where, we just tell them about the resource or the different CBOs that they might benefit from, and they might go out there to connect with them and gain their services. Or there might be individuals that might actually need more hand-holding, where we connect them and we submit the referrals on their behalf. So if that is the case, then we would obviously need ROIs in place to be able to work with you guys for, each member, or, and so that's the, it really depends as far as the level of support that member needs. I don't know if that answers your question.
Yeah, no, that's helpful. Kind of related, are you familiar with Unite Us? It's a referral network that, do you implement Unite Us at all?
We don't. So the only thing that we're currently working with is it's the Help Now, and we also have our own database that is able to basically find the different CBOs or the different needs, whether it's medical providers or specialists. So we do have something that is kind of similar to Unite Us.
Okay. And so, I mean, one of the things with Unite Us is like, we can look back and see whether a referral was accepted, whether that, person is being served. Would we be able to, if we referred someone, would we be able to follow up and say, were they actually eligible? Did they participate in your program? That sort of follow up, so we would know.
Yes. Yes.
Okay. And then one other question I had, obviously, housing is a huge issue right now, even bed space at shelters and things like that. So I was just curious about your kind of approach to housing, or what resources you have. We do have, kind of a outreach team that we can sometimes have come up and get someone. Do your community health workers function that way? Are you hooked in with shelters? I would love to hear a little bit about housing and what that looks like for working with this population.
That's definitely an area that we are going to see a lot of struggle with, just because that is a high need, especially for our county. There is a lot of, problem with homelessness. And so what we're doing is really getting the word out and really partnering up with different agencies. And they're definitely one that we are looking at closely to see how we could support one another to work together as a team to really support our community. And so we are doing a lot of outreach, not only to, just members out there in the encampments, but also to different agencies such as your organization, to really connect and figure out how can we benefit in serving, our population, our community.
Great. Well, anyone else have questions? Those were some of the ones that came to my mind. All right. Well, if there's no other questions, thank you so much, Laura, for presenting on this. It's definitely something that, my advocates encounter quite a bit. So it's good to have one more resource to think about how that might work. We do find that more of our clients seem to be on Kern Family than HealthNet,
Yes.
but it's good to know that you're working on that
That's in the
approval.
works, and we're hoping that it's gonna, we're gonna finalize it at the beginning of this month, or not this month, but beginning of November, I should say. I feel like I'm already in November.
Yeah.
So that's the plan, and hopefully, we're going to start with Tehachapi, and then eventually we are going to expand. We do know that current families has basically the most members enrolled in that particular health plan, and so hopefully we could do that soon. And one last thing, I did leave my information or referral process for you guys so you guys could see it. And then I also would like to email you or brochures as well as a little bit more information about our program and the referral in the event that you guys do have individuals that could benefit from our services, or if you have questions and you just want us to just ask additional questions, or if you like us, anyone would like for us to present, we're more than happy to do that, just to really get the word out there and really maximize our services.
Great. Yeah, I know you did send me some early on, so I do have a few things from you, but
Okay.
if you want to follow up, if there's anything else, I think you sent me like at least 3 documents early
Yes.
on, and I was planning on in the follow-up email from the collaborative to send those out.
Perfect. Thank you. Then I won't send them to you since you have them already.
All right. Well, perfect.
Thanks.
Well, thank you so much. Any final questions for Laura? Okay. Well, great. So the next part is that I wanted to do is kind of a little bit of planning, a little bit of discussion about where the collaborative's been, and then talking about where we want to go in 2023. So some of you have been on with us from the beginning of our kickoff. So just for those who are a little bit newer, we kicked off again in April 2021. So we're about a year and a half into our kind of revived collaborative. And what we looked at, we had done a community needs assessment, and we as a collaborative voted on some priorities. And we did that in like May of 2021, and then kind of worked on some of these over the last year and a half. So just as a refresher for those who weren't with us then, didn't vote on them, we had 4 priority areas: senior services, mental health services, youth services, and then a focus on preventive healthcare. And again, those came from, we had done a community needs assessment, and so we kind of had what the community voted on as important to them. And then as a collaborative, we narrowed that down to these 4 areas, and had presentations and did workshops and had some different events to kind of get at each of these areas. Something that some of you may that has come up more recently that you may remember, we talked about this in kind of in May, June, was a broadband for all, and trying to tap into some federal funds and state funds that were being presented to increase broadband access. That's obviously a concern for our schools, that some kids don't have internet access at home. And so one thing that I hadn't shared, though, a small work group from our collaborative that had been working together, we created we were interviewed and moving forward with a grant process. And I hadn't really shared this with the full collaborative, so I wanted to take a minute to just share a little bit about what that vision was looking like, what we were trying to achieve. And so this is what we shared with the interviewers for that grant that we were working on. A little bit of our community kind of background, and which a lot of you are familiar with, the kind of education and socioeconomic background of our community, a little bit about our collaborative and some of the various partners that we've been gathering and working with. And a big focus of this grant, besides just increasing broadband access, what the collaborative brings is the kind of community engagement, ability to work with people on digital literacy. So that's a big part of some of these broadband initiatives that are happening at the federal and state level, are to actually increase digital literacy, to get people online and connected in ways that they haven't been before or that they're not very comfortable being. And so we outlined a few of the things that were already happening, both with the school district, with the Chamber of Commerce, with the Family Resource Center and the library. And then we were looking at kind of two different things to increase our digital literacy in the community. So one is kind of universal literacy, basic skills necessary for engaging with life in a digital society. So things like internet safety, privacy, security, general knowledge, how to use devices for everyday. So many things are moving online, and some of our residents are not, they don't have the skills yet to be able to take advantage of that could maybe open up more opportunities for them. And then the second piece was creative literacy. So actually using it to, generate creativity. And that could look like small businesses being able to more effectively use tools. We also were proposing to do a community needs assessment again, which is something that the collaborative, to keep our accreditation, we have to do periodically. So that would be coming up for us in 2023 to do another community needs assessment. And we wanted to really kind of get even a broader swath of the community to weigh in on that. So again, these are just some of the ideas that we were proposing about how to expand universal literacy, as well as some ways that we could expand creative literacy as well through various kind of partnerships. So that's something that we were working on, but part of why I wanted to bring that up is that we've been a little bit stymied, I would say, because we're a small community and we don't have kind of a local government per se. So we're in this unincorporated area. And so as I've attended different workshops and webinars and tried to figure out what that would look like, we don't necessarily have all the infrastructure in place that some of the people who are getting those grants have in place right now. But I wanted to give that background, because one of the things that I want to do is to kind of have us do a little poll, take a pulse check on what we want the collaborative to focus on in the new year. And so I'm going to put first to put up. Now this is kind of our, again, I called it a pulse check because this is kind of our first kind of talk about this. This is our last meeting of this year, and I wanted to kind of hit the ground running in January. But we're probably going to still be working on honing what are our priorities, what do we want to really focus on next year. But I'm going to throw up a poll, and it has some of the things that we had as our collaborative priorities over the last 18 months, but it also has some other ones that came up in that initial community needs assessment. And I wanted to kind of see where we're at on what you're seeing in the community, what you think are the collaborative should put some of their effort into. So can everyone see the poll? And yes. The other thing is, jump into the poll and you can check more than one. And again, this is like a kind of first step in thinking about where we want to focus. But also, if there's something that's not on the poll that you think, oh, this is a really big issue, this is something that we really need to focus on, put that into the chat as well. And there are some people who are active members of our collaborative, but not always able to attend these meetings. And so I am going to be reaching out to them as well and kind of taking, getting their input on priorities. But let's see where we're at with this group and as a first step in setting some 2023 priorities. And again, if you have anything else that you think of that's not on here that you think is really important that we want to consider, throw that in the chat as well, and we'll use that as we move forward. Right.
I did want to say something. So I'm not sure if GBLA is part of this collab, but I know that they do have some great services for older adults. So I'm not sure if you guys have had them present, but I know that they do a really good job. They have so much information for that. And I do have one of their pamphlets if you guys would want me to share it with you.
Yeah, we have had GBLA actually a couple of different times on some of their different projects. So yeah, they definitely do have a variety of things. I'm always learning about something new project that GBLA does. But yeah, they've presented to us on their mobile home advocacy program, on their fair housing, and then their kind of general services as well. But
okay,
yeah,
that's
thanks.
great.
That's a great tip, Ashley. And that's great too, because I do actually have another poll related to our collaborative topics, presentations that we want. Yeah, Laura, thank you for bringing up child abuse prevention. That is something that is a huge part of what the Family Resource Center is focused on. We have our First Five 0 to 5 funding, and Kevin with First Five is with us today too. And that's one of our big goals, is to support families so that it reduces incidences of neglect and mistreatment. Thank you, Katie, for your thoughts too about vision and hearing screening, affordable glasses, hearing aids. Yeah, that's a great.
Yeah, we have screening at the school sites, but it's typically only for certain grade levels. Something we ran into here at El Cajon this year was we had vision screening for only our, I believe it's our 5th and 8th graders. And in that and on our SPED students, 11 students within those 3 categories just failed the test. And that's another issue we have, is that they come and screen, but they only say pass or fail. They don't give a prescription. And so we're trying to find a way to, we have for those 11 children, but we also need, you know, our 6th and 7th graders to be tested, and our high schoolers and our young children as well, a way to maybe do like some kind of mobile clinic where they come up and can provide a prescription. And then, you know, maybe even vouchers for glasses. We do have, you know, a medical fund here that we're able to spend on those kinds of things, and we're happy to do that. We just need the resources, and I've been reaching out, and we've kind of hit a dead end there. So I'd love to talk with you more maybe later if you have any insights or connections we can move forward with.
Yeah, that's really good to know about. And we did used to have some vision vouchers. We don't have them currently, but yeah, that's something I'd like to talk to you about. All right, well, thank you all for weighing in. I'm gonna end the poll, and then I will share the results so you guys can kind of see where we're at so far. So just from this initial, mental health services is obviously huge. I don't think that's surprising at all based on, you know, the last couple of years, what we've seen. So again, this is a great kind of first step. And then I'm going to continue to reach out to some other collaborative members that aren't here. But related to that, I also wanted to touch base on some topics that you would like to have. The ones that I have here are places that I've been in touch with recently, or people that have reached out to me about presenting. But again, just like with the you know, general priorities, if there's something that's not on here, an organization that we haven't heard from yet, or that a topic that you want to know about, you can definitely put that into the chat. These are just ones that I've had some contact with lately, or that people have suggested to me. So I wanted to kind of get a pulse check of where our collab members are about what they'd like to hear more about and what would be beneficial. And yeah, again, just throw any other ideas into the chat, or any other organizations, just like Ashley did, sharing that potential, you know, connection with GBLA. If you have any other organizations like that you can think of that would be beneficial for us to hear from. Great. All right, we have almost everyone having done the poll.
Lindsay, I just wanted to
Yeah.
put it out there that our contract is for promoting California Telephone Access Program, and then we're supposed to also promote broadband, free or discounted broadband services, and free or discounted mobile and or telephone service. And so I will be on vacation next week, but we will be receiving the training, and we're supposed to incorporate those two aspects of services as part of our CTAP presentation. So
Oh,
as soon as we get that, I've seen mock-up flyers. There isn't anything that's approved from the state of California yet. But it's been a little bit over a year, but
yeah.
that's gonna be part of our presentation. So as soon as I get that out, I will definitely share it with you and the group.
Yeah, that would be great to have you present on that. Yeah, we definitely, I've been trying to learn more about that area, but there is so much going on that it's hard to wrap my mind around it all. So yeah, I'd love to.
Yeah,
have
and
you
it's so
share.
complicated because broadband is so different depending on where you are. And us being a statewide program, we have to provide just 1-800 number for, whether you live in the mountains or you live out in, LA or whatever it is. And so, yeah, we're really excited about that.
Great. All right. So I will share the results of that so you guys can kind of see that as well. It looks like on the homelessness and domestic violence, there's a lot of interest in hearing from them, but all of these topics got some interest. So this will be a help in me starting to plan for next year. Heather actually asked a question in the chat that I would love to see a little bit of a response from the schools potentially about foster youth and how many foster families there are in our community. And that's actually a really good question. As a former foster parent myself up in the community, I knew of about 5 families that were with my foster family agency when we were living up there, or when we were fostering while living up there. But she's wondering about, are there supports for foster families? Do we, is that something that we need to look at, providing more supports? Sarah, yeah.
I was just going to say we do. I do not know the percentage of the fosters off the top of my head. I could get that actually very easily from Pam Childs, but we do have a large percentage. Foster and homeless. Our homeless percentage actually went up drastically over the last couple of years. So we do offer. Corey Hansen, the middle school principal, she's at a conference today, so she couldn't be here. She is our homeless foster liaison, and they do a lot throughout the year for both of those groups. We try to, we start at the beginning with getting them baskets full of gift cards and all kinds of, actually Katie's on here and she helps her with that. They go hand deliver them and everything. So we do give them as much support as we possibly can. But the percentage of both of those groups in the mountain communities is growing drastically. So I would think that it would be something, that we could concentrate on.
The reason I asked the question is I work with Kern BHRS, and we primarily, the program that I co-facilitate with my supervisor, it's really geared towards those at-risk teenage youth who can't find placement, or they're in a rocky placement and their behaviors are going to cause them to lose placement. So one of the things that we offer, it's an umbrella program with DHS, is how to teach foster parents just how to really work through those risky behaviors that may cause them to give a 14-day notice. We do, through everything is really through that mental health lens, trauma informed. I just want you guys to know it is a resource to you guys that I could always come out to the schools. I could reach out to the foster parents, provide a training. It's always going to be a resource. Just I don't really get a lot of phone calls or bites from anybody in your community. Kern BHRS, we have such a large geographical area. I think is your guys' geographical area for mental health services, it's not BHRS, correct?
It is.
So,
as far as us with Clinica, we're contracted with current BHRS.
Perfect. So I'm definitely a resource if you guys see foster parents struggling, and we know of a identified foster youth that may have a co-occurring diagnosis, especially with mental health. So I just wanted to put that out there, and I'll make sure I attach my flyer.
That would be wonderful. Thank you.
Great, Heather, thank you. Yeah, a couple of other comments in the chat about that. Kevin talked about educational supports available for families. I think that would be a great thing to, talk about in the new year. So great. So just a couple more really quick polls that I wanted to, again, just get a pulse check on and see where we're at. We've been on Thursday mornings, and I'm wondering, I know maybe January seems far away, but how does Thursday morning, how's that working for people? Are we liking this time? Is anyone, is there interest in other times or pursuing other times in the new year? So curious how people are feeling about that. I know there's a couple of people who email me here and there because they just can't make the Thursday morning time work. But if this is still the preferred time for most of us, then, I'll just continue to sort of relay information otherwise. So yeah, weigh in on that. And then the last one that you can kind of start thinking about as well is the last poll is just related to our venue, whether we want to continue with Zoom only, do more of a combination. So, all right. Well, it looks like overwhelmingly this group, which maybe isn't surprising because we're all here, is likes the Thursday morning. There's just one vote for a kind of Thursday midday. But then the final one, like I was saying, is just thinking about, a lot of things that had been on Zoom are coming back in person. I definitely don't lean toward in-person only, just because I think that will be much harder to get some of representatives from Bakersfield presenting. I think we've been able to get a robust diversity of presentations because of doing it on Zoom. But I am curious, how people feel about getting some in-person collaborative meetings and what the thoughts about that, the benefits of that. So thank you for weighing in on that. Okay, so great. Well, we got everyone participating on that poll, and you can see the meeting once per year, but being primarily on Zoom was the biggest vote getter. That's something that I was leaning toward myself, because I would like to, kind of get together in person as well, and continue to kind of build those connections and what can happen in person. But I obviously think Zoom, I've been in contact with collaborative coordinators in other outlying areas and rural communities, and they are also sticking with Zoom because of that benefit of just being able to get people together more easily. So, well, thank you so much for kind of weighing in on these things so that we can start looking at next year. And any other last thoughts as we think about priorities or the schedule or anything that anyone would like to add? Great. Well, this will be the first step in that conversation of establishing our plans for 2023. But in the meantime, this is the time where we kind of give people an opportunity to share about events, resources, various things like that. Heather, I saw the sheet in the chat. I didn't know if you wanted to share it with everyone. It was just shared with me initially. But if you wanted to send that out to everyone. I have some things I'm going to put in the chat, but I want to turn it over to you guys to jump on and share.
Hi, I'm over at the CAPK Friendship House Community Center. Over here, we have a mentoring program. We assist youth, at-risk youth between the ages of 6 to 17 years old. And we could do that through Zoom, through phone call. And if there's enough students on campus, we could do that by visiting the campuses as well.
Great. Thank you. Who else has something they want to share?
I just wanted to introduce myself. For those of you that don't know me, my name is Brooke Oscarson. I am the field representative for Assemblyman Vince Fong. We could do anything from reaching out to state departments like EDD, Franchise Tax Board, you name it, just reach out. And if we can't help, I'll refer you to someone that can. And we also do community outreach. So if you guys do have events, you guys can send them over to us, and we like to try to attend and show our support and advocate for you guys. So if you need anything, just reach out. I'll put my information again in the chat if you guys need it.
Great. And I know I always say this, but Brooke has been very helpful to us at the Family Resource Center, trying to track down information and get some answers from state agencies.
I have a question for Brooke. So you said you work with EDD, so you help people when they put in applications, or how does that work?
So after the individual submits the application, and let's say they're waiting for an interview, you guys can send them over to us. We can check and see if they're in our district. If they aren't, we can send them over to the representative that they are in, and we can expedite the process for them. Or if they're having trouble receiving payment, I can also reach out to EDD and kind of figure out what's the holdup. We can submit documents for the individuals, anything from just reaching out and try to get some communication between the state agency and the individual, just because EDD, I hate to say it, but they're very hard. Some of their documents are hard to understand, and that's kind of what we're here for, to kind of bridge that gap between the constituent and the department.
Okay, yes, because we have a client that both Claudia and me have both been dealing with her. She's having a lot of trouble getting her payments, and she had an appeal, and I helped her resubmit a claim. And since then, she still hasn't received anything, and her case is just like in the air, and she doesn't have any other income coming in, so she's struggling so much.
Yeah, I'll put my email in here and have her email me, and I can have her fill out our release form, and then we can move along with the process, and I can kind of figure out what's going on.
Thank you so much.
No problem. That is what we're here for. I like to solve problems. So I'm like, send them my way.
Great. I know, Kim, you put your Diabetes Month calendar in. I didn't know if you wanted to say anything about that. Kim is with Henry Mayo and presented to us on their community education a little bit a couple months ago.
Here I am, sorry.
No worries.
Okay. Hi there, sorry. Yeah, so November is Diabetes Month. We have a whole month's worth of classes and events. We have some new classes that we'll be offering. November 14th is World Diabetes Day. On our hospital campus, we're going to be having our Diabetes Action Day. We're going to be exercising on the hospital campus all day. We have Zumba, all different kinds of classes where the campaign is called Step Out, and we're literally asking our employees and our community as well. I know it's a little bit of a drive, but if you happen to be here on the 14th, we're going to be inviting everyone to get in some extra physical activity that day. I'm so glad that you brought up the broadband and the technical literacy. I think that would be wonderful. When I did come to the health fair at the elementary school back in June, that was one of the seemed to be one of the barriers, because we would really love to offer our free services here to your community. And I do think that would be, if we could get over that hurdle, I feel like we have free services that we would love to offer your community. And I'm very excited about the possibility of getting together with you all in person once a year. That would be fantastic.
Great. Well, thank you. So I also shared several things in the chat. So I just wanted to kind of run down there's a clothing giveaway, community dinner, and trunk or treat that is on Saturday. And that's all going to be free for kids, seniors, adults, everyone. And it's going to be warm winter clothing. I don't know, Misty, if you want to add anything. Misty is the kind of coordinator behind that event, but that's something I wanted to help spread the word on. And go for it, Misty.
Just read, anybody's can come. We don't check income. We're not looking to see if they fit into a box or anything. So it's open to everybody. We've reached out to all 3 schools. We put it on Facebook. We're advertising that. Some of you have seen our office next door. It is just loaded down with clothing. We filled a whole 10 by 12 room full of clothes. We have blankets, shoes. We've had people buy brand new socks. So it's all there. And then it'll roll right into a warm community dinner. So at 3 o'clock, then we'll flip from giving away clothes from 10 to 1, and then dinners from 3 to 5. And that's soups and stews and chilies. And then at the end of that part of the event, anything left over, we've got containers to send home food with people so that they have warm food for the weekend, which is supposed to get colder and into snow next week. So we're trying to keep our community warm. And then we're going to have our trunk or treat that starts at 4 and goes until 6 p.m. So it's a safe environment for the kids to trunk or treat. We've actually got the community building, and so they're going to be between the community building and the park, and we'll have that blocked off so nobody can be driving around our kids while they're trunk or treating. And I think we're up to 28 cars signed up to give out candy and treats that day. So we're very excited. So please come and join us if you're available.
Great, thank you. And then Jennifer, why don't you jump on and share, and then I will finish going through some of our flyers.
Thank you, Lindsay. Jennifer Williamson, I'm a therapist and clinic manager here at Clinic Sierra Vista in Fraser Park, Behavioral Health. Just letting you, I don't know who knows, but we will be moving down to the health clinic on November 18th. So we won't have any disruption in services other than that Friday, November 18th, and then we'll be back to business as usual after that. So minimal disruption for our clients, but hopefully it'll be a good move and, better for clients to have medical care right there as well for us to get them connected even sooner.
Great. Well, that's a good to know. Good update. Yeah, I hope that's a great move for you guys. Thank you. So then the next one that I put in the chat is the library haunted house. So the library is part of our collaborative, and the MCFRC is going to be supporting that. The haunted house in the recreation center is for adults because it is a true haunted house. But we're going to have kids crafts outside, snacks. Jessica's going to be out there helping facilitate that. We do also have 2 vaccine clinics, one vaccine clinic. I put in 2 flyers, one in Spanish and English. That's November 2nd from 9 to 3. Kern Public Health is coming up. There'll be flu shots, 2 different kinds of COVID vaccine boosters, COVID testing. So that's going to be in the park next Wednesday. And then I also wanted to mention we have a high cap counselor that's coming from Aging and Adult Services every 3rd Tuesday. To kind of meet with the community people, anyone who has questions about Medicare, enrollment. Right now is open enrollment period, and so it's a good time to kind of recheck everything, your medications and what's covered. And Adrian has been coming lately, and he is open and ready to do that. So if you know of a senior who could use help navigating Medicare, or maybe they're not on Medicare yet, but they need to start planning or understanding that process, he's a great resource. And then finally, I just wanted to share that as of November 1st, our Toys for Tots applications are going to be open, Gifts for Teens, Toys for Tots, where families in the community can get that extra support to help give their kids a great Christmas. So you can spread the word to any families that you know that that would benefit from that. So those are all the things that we're working on. And I see Paku put in information about her Lunch and Learn. Did you want to jump on and share anything about that, Paku?
Sure. Every third Thursdays at noon, we do lunch and learn, and then we're still doing smartphone training. But like I mentioned earlier, as of November, we will start be doing, including in our presentations about discounted or free broadband and discounted or free telephone services. So that's something we're really excited about. And whereas they could just call 1-800 number, and no matter where you live in the state of California, it will take you to the broadband service where you're at, or the local or cellular service that you're at, and they can get you assistance to find what's available in your area. And so that's really awesome. And that's about it.
Great. All right. Anyone else have any last things that they wanted to share? Events or information? Right. Well, thank you all for joining us today. And we are going to take a break in November and December, since it gets pretty crazy at the Family Resource Center with Toys for Tots and all of our holiday endeavors. But I'm looking forward to kicking off again in January. And thank you all for joining us.
Bye. Happy holidays. See everybody next year.
Bye, Paku. Thanks.
Happy holidays. See you guys next year.